Cerebellar Liponeurocytoma, a rare entity, a case report. Oliver Gembrucci male author, Andreas Juncker, Yaya Amadapur Ulrich Schur and Elias Lemonas. Journal of Medical Case Reports 201812:170. DOI.org web link. The authors. 2018. Received, 3rd of April 2018. Accepted, 1st of May 2018. Published, June 17, 2018. Open Peer Review Reports. Abstract. Background. Cerebellar Liponeurocytoma is a rare tumor of the central nervous system occurring mainly in the posterior fossa, which shows neuronal and variable astrocytic differentiation with foci of lipomatous differentiation. Liponeurocytoma develops in adult patients and is defined in the World Health Organization classification of 2016 as a rare benign grade 2 tumor. Case presentation. A 39-year-old Italian man presented to our department suffering from headache and nausea. Magnetic resonance imaging revealed a right-sided cerebellar lesion showing poor contrast enhancement without an obstructive hydrocephalus. Surgery was indicated and total tumor resection was achieved. He was discharged without any neurological deficits. Histopathological examinations revealed a cerebellar liponeurocytoma. A neurological follow-up examination revealed no neurological deficit directly after surgery and 1 year later. Radiotherapy was recommended at the neurological board despite the total removal of the tumor, but our patient refused adjuvant radiotherapy. Magnetic resonance imaging of his neurocranium with and without contrast enhancement 48 hours after surgery and 15 months after surgery showed no residual tumor. Conclusions. Liponeurocytomas are rare benign tumors occurring in the majority of cases in the cerebellum. The therapy of choice is surgery. Postoperative radiotherapy has to be discussed individually, but seems to be sufficient if complete tumor resection is not achieved or in cases of a tumor recurrence. Keywords. Cerebellar liponeurocytoma, cerebellar neoplasm radiotherapy. Background. Cerebellar liponeurocytoma is a rare tumor entity mainly located in the posterior cranial fossa and typically developing in adults with a favorable clinical prognosis. It is histologically characterized by lipidized cells found in clusters or scattered between small neoplastic cells. Immunohistochemical staining shows advanced neuronal, neurocytic differentiation with a low proliferation index. Liponeurocytoma was first described in 1978 by Bechtel et al. As a mixed mesenchymal and neuroectodermal tumor in a 44-year-old man with a cerebellar lesion. 1. Some previous cases were published as unusual metaloblastomas in adults, lipomatous metaloblastomas, lipidized metaloblastomas, neurolipocytomas, or metallocytomas. The World Health Organization, WHO, recognized it in the 2000 WHO classification as a cerebellar liponeurocytoma, emphasizing its neurocytic differentiation, and classified it in the group of neuronal tumors. 2. In the WHO classification of 2016, the tumor was classified as a glioneuronal tumor and was upgraded to grade 2 due to the results of long-term follow-up studies showing a higher recurrence rate than originally expected. 3. Although findings from computed tomography, CT, and magnetic resonance imaging, MRI, and pathological and immunohistochemical characteristics have been reported in around 70 cases, clinical and pathological diagnosis of liponeurocytoma remain challenging and the characteristics of this tumor entity are still poorly understood. Accurate differential diagnosis of this rare central nervous system, CNS, tumor from mother brain tumors such as medulloblastom or oligodendroglioma is important to avoid unnecessary aggressive adjuvant therapies. This case report presents a rare case of a liponeurocytoma located in the posterior fossa and summarizes the typical radiological and histopathological features of this rare tumor entity. Tumor recurrence, adjuvant therapy, and important differential diagnoses are discussed.